And as a matter of fact, this is a controversial topic that gave me a lot of headache, but I think I found a good solution to get around the sharp edges. So let's begin with general medicine. I was surprised to read that rhinoplasty was performed today more often in minors, 12 to 19 years, than in adults. Did you know that? I didn't know that. And breast surgery, especially reduction, is even being paid for in Germany by the insurance companies when there's a medical issue in terms of posture and spine problems. So this is a very different situation in ophthalmology, where, as a matter of fact, today refractive surgery in children for now is limited to the treatment of refractive amblyopia. And we all know that amblyopia has to be treated until the age of 6, 7, or 8 years. After that, it doesn't make really sense. But in this nice publication of the American Academy, it's a good wrap-up what is known about refractive surgery in children, and there's very little information available. So on the other side, we are facing the myopia pandemic, and that will increase the pressure on refractive surgery and possibly lead to a weakening of the current age of majority limit. And Arthur and I, we had this editorial discussing the issue of myopia control from the perspective of refractive surgery, where we all know that those who do myopia research, they don't have refractive surgery at all on their radar. This is not even discussed. So there's an open field, is a terra incognita, so to say. I know, as you all, that there are colleagues around that do surgery on minors, if you talk to colleagues. And so I wanted to find out some real-life data, and the idea came up to do a survey and ask colleagues, and with the support of the Refractive Surgical Alliance and World College of Refractive Surgery and Visual Sciences, we performed this questionnaire. It was 10 questions, and we received 137 fully filled out answers to the questionnaire. And it's quite interesting what we received in terms of answers. Well, first of all surgeons, they are aware and agree ethical and legal considerations that come with performing refractive surgery on children. So there is agreement on this, of course. The answers, if you look at the numbers of surgery that are being performed by the different surgeons, you see that the answers indicate that the survey is not representative. But if we count together all the number of eyes, we come to 1,000 or 2,000 cases represented in this survey, which gives it a certain level of, let's say, relevance. I would like to ask you guys, have you ever performed refractive surgery on children? So you see it's being done. I myself would put myself in those cases, 1 to 10 cases, not more. But there are surgeons who have done more. And there's one concern. Most surgeons, like myself, have little experience in treating adolescents because they treat this age group only sporadically. And reports from more experienced surgeons are not available because they have not published anything. We don't know anything. So the questions go on, and we ask about the policies performing refractive surgery on children, and the surgeons are in consensus that only pronounced visual defects and significant visual disturbances or other medically relevant indications are present. And the preferred pediatric surgeries are, and that was a surprise for me, LASIK and ICL. ICL, it's reasonable in high myopes, and when laser vision correction is not recommended. And LASIK, the question here is, does patient comfort take precedence over safety here? A number of questions could be answered, made. So if you look at the potential risks and complications of pediatric surgery, most of the surgeons announced regression as a consequence of reorganization of tissue or a consequence of actual length. It's not clear. We don't know. It's not answered. This is an open question we need to find an answer to in order to place refractive surgery on the scale of potentially methods for myopia control. We don't have a control group, and those who are doing these kinds of or have the possibilities to do these kinds of studies and surgeries, they should really look at this issue in terms of myopia control, because there is a potential application here, I think, for refractive surgery. Now, if it comes to ectasia, of course, we think about ectasia in young patients, but what is really the weighting of the corneal age in the multimodal interaction of all diagnostic parameters? If you have a 16-year-old with a 550 cornea, absolutely normal, no tear fill problem, is he in risk just because he is 16? So the real weighting of age is not really known. We don't know at all anything about that. So outcomes are similar or better in comparison to adults. That's what the answers were. And it was noted that there's better neuroadaptation and less dry eye issues in young patients, what we would expect. So let me come to the quintessence, and there is currently agreement that there's no scientific basis to carry out treatments on minors. However, it would be desirable to work on the results of the treatment of young adults, as Georges II Alliot has done in this wonderful publication, which received the poster prize last year at the AECOS. It's a very important work because the deductive insight that we gain from this kind of publication can help to secure the treatment of minors in individual cases. I'd like to acknowledge the support of the Refractive Surgical Alliance and the World College of Refractive Surgery who helped me to perform this survey. Thank you very much to the AECOS and for being here, and I'm happy to answer your questions.